Good evening, Los Angeles, and thank you, as always, for joining me for this evening briefing that summarizes the end of this week in our struggles to not only combat COVID-19 and to deal with the economic devastation, but to march forward in this moment to heal our country and our city. As always, this is a moment for us to come together, to share the science, to hold the hurt, and to find the hope and the help that we need to get through each day and to get through this struggle together. My grandfather, Salvador, was part of what is described as the greatest generation. While he passed when I was in college as a young man, I grew up with him around, and I remember the feel and even the smell of his uniform from World War II. He was an immigrant from Mexico who came to this country as a dreamer, earned his citizenship when he helped us fight and win World War II in the Pacific Theater. And he was part of that generation that literally put their lives on the line to make sure that this country and this world were free. You know, the pages of history are filled with everyday men and women like my grandfather Salvador, who answer the call, courageous women who asserted their rights in Seneca Falls so that women could vote, students and leaders of conscience who marched across a bridge in Selma, Alabama, the legions of workers here who built the planes and the parachutes needed to save a continent and to end a brutal war. The dreamers and the doers who seemingly did what was impossible, but who reached for the heavens, put human beings in space so that we could graze the cosmos from outside the atmosphere. What will future generations remember about us? What will they call us? What will they see about our time and the call that we've been asked to answer? Will they look back on the actions that we took to control a deadly virus, the most dangerous in over 100 years? Will they say that we met the challenge, that we met the moment, this threat that has already claimed more lives than all the fallen from the Korean and Vietnam wars combined? You see, what we do today will not be lost in the history books. It will be remembered and recorded. It will be resolved for all of history moving forward, and it will define our generation. So let's make our actions count. Let's get this right. Struggle is just that. It's struggle. It's never easy. It's never perfect. There are steps forward and there are missteps. But together we must keep marching through this fire. And I'm asking you to enlist in this fight. Past generations literally ran into battlefields or on protest lines and gave up everything, paid the ultimate sacrifice to fight for their values. What am I asking you to do? Wear a mask. Keep your distance. Stay at home. Wash your hands and surfaces. They might seem small and trite in comparison to people who have taken guns to a battlefield or signs to a protest line in days past, but they are not. These are the actions of saving life and writing our history and this moment, to save both lives and livelihoods, to breathe back hope and help into our neighbors. So let's get into that tonight. It's been just over 4 months since Los Angeles became the first big city in America to begin shutting down many of our businesses that were considered unsafe in the midst of this new threat that we learned about. Along the way, though, we've learned so much about this virus, even as there is so much left to learn about it in our fight to conquer it. Through it all, we've kept a simple promise to you: to be guided by the best information, to listen to the doctors and the science, to look at the data, and to keep our residents and businesses as healthy as possible and as informed as possible in this challenging time. Tonight, I have some good news, some help to share. Our small businesses need every bit of immediate assistance that we can provide. And tonight, I'd like to announce another step forward in our support, helping our local businesses and their workers by providing funds needed to help them stay in business and to meet their payrolls. Working with Councilmember Curran Price, who chairs our Economic Development Committee, Council President Nuri Martinez, and this entire city family, we are investing an additional $10 million this evening in funds for the LA Regional COVID-19 Recovery Program. This is a joint partnership with the county, and I want to thank each of the Board of Supervisors and our county counterparts. This comes on top of an existing $3 million pot already dedicated to this initiative. We now will be able to offer grants, not loans, but grants, to the small businesses and nonprofits that are the lifeblood of our economy. These aren't loans where you'll incur more debt. These are direct cash assistance to help those who need it the most. And this funding is designed specifically to assist our most vulnerable businesses who did not get served by our federal Paycheck Protection Program, maybe because they're underbanked, maybe because they didn't have the staff. But we know too many small businesses, especially on our main streets, Black-owned businesses and immigrant-owned businesses, women-owned businesses and family-owned businesses, were not helped enough. We will send out these grants in 6 total rounds. So if you're not selected in the initial wave, there will be 5 more waves ahead, and we encourage you to continue to reapply. To learn more and to apply, please visit the website at lacovidfund.org. That's lacovidfund.org. Or contact one of our city's business source centers, and you can connect with them through 311. The next round of applications will open on Monday and will last through the balance of next week. Many of you took advantage this week of applying for a program to help our tenants and landlords. We were the first city to enact an eviction moratorium, and both residential and commercial tenants cannot be evicted by their landlords during COVID-19. After stopping evictions, we also froze rent on all of our rent-stabilized units, which accounts for more than 80% of our rental units in the city, 624,000 to be exact. And now a rental assistance program is answering the calls of tenants who can't make the rent and landlords who are worried about their mortgage, putting $103 million out there to help renters stay in your homes, 50,000 of them with $2,000 of assistance to help cover rent for our hardest hit households that are here in Los Angeles, that earn less than 80% of the area median income, and who have lost some financial good because of COVID-19. So far, we've had 200,000 applications submitted. Some are from outside the city, and we'll have to take those out because this is just a specific program for city residents. Some of them may be duplicates, but till midnight tonight, you can still apply. And I encourage you to go to hcidla.lacity.org. The phones are open till 10 o'clock and midnight online. So please let us know, and the number to call is 844-944-1868. We had, as I mentioned earlier this week, about 140,000 applications the first day. Thanks to the good work of so many people. While it went down for about a half hour, we quickly jumped back up, and about 10,000 new applications per day have been well managed by the process every single day. So again, those phone lines are open till 10, and the online applications till midnight tonight. I also want to share some good news with you from our hospitals, which have learned a lot. And I hope people are still ringing those bells each evening. I hope some of you are stopping by and honking your horns to thank those workers who are still on the front lines, from janitors and techs and nurses and doctors and everybody who is still showing up to work even when we're exhausted by COVID-19. They have no choice, and in fact, they serve from their hearts. Those who are in our skilled nursing facilities and other places in our care economy, who are taking care of the most vulnerable amongst us. But the good news from our hospitals, which have learned a lot about how to treat people who are severely infected with COVID-19, doctors are now using high-flow oxygen in many cases instead of ventilators. We have news that drugs have also been effective in helping reduce blood clots, treating inflammation, or helping people with lung injuries or oxygen deficiency. All of that is helping to shorten hospital stays. So even as our numbers have gone up, the stays are shorter. And also some positive news from the scientific community is that there are at least 2 vaccine trials that are showing deep promise. Our goal, though, is to keep Angelenos from ever needing to go into a hospital, from getting infected. And our goal tonight should be to get off the state watch list for 14 days in a row. As we heard from the governor, that is what we need to have the foundation for our schools to reopen, for our economy to thrive. I hope all of us will look at that as our mutual and individual goal, to do everything we can to continue to push this second curve down and to see if we can have 14 days in a row the conditions from the states to possibly having our schools open and our workforce protected. It will help us prepare for the flu season, help us save lives, and help us each feel in control of this thing that makes us feel so much not in control each day. And right now, we're still headed in the wrong direction. Now, I caution because, as I said last week, the numbers we would see for the next 2 weeks, including this week, reflect where we were 2 or 3 weeks ago. It doesn't mean that what you're doing right now and doing better isn't having an effect. It just means we'll begin to see that a week from now and 2 weeks from now. So keep on pressing, keep on wearing the masks, keep on washing the hands, keep on keeping your distance. Avoid the 3 C's of close contact, of confined spaces, and of crowds. But right now, infections are climbing, hospitalizations are climbing, and deaths are climbing. This week, we had 3 record days on Sunday and Tuesday and Thursday of more cases than we've ever seen before, each day shattering the previous record. This is an extremely dangerous situation, and it remains that way. The United States has a little over 4% of the world's population and 23% of the world's deaths. Cases are rising in 41 states, and even the 9 states where they're not rising, there's worrying signs. We saw 77,000 cases in a single day in the United States of America yesterday. We hit an infection record with close to 4,600 cases, and we've now lost more than 4,000 Angelenos to COVID-19. All cities are in this fight together. All states and nations are in this together. And while here in Los Angeles we have fewer infections per 100,000 residents compared to many other large cities across America, we cannot let up. We cannot let what we have gained and what we did fall by the wayside as we get tired in the face of COVID-19. We need to wear our masks and avoid gatherings. It's why we had to close more businesses in this state, because they promote indoor gatherings, and that spreads the virus. I said earlier this week that the COVID threat level was at orange and getting closer to red. If we went to red, we would go to a full, safer at-home order, and we still remain there on the edge as I speak to you today, though I'm hopeful that your actions in this coming week will show our numbers begin to come down. But this week doesn't lie, and the data doesn't lie, and it still is very dangerous. Today, we're holding off on any additional closures to see what the impact of our collective action is. Our situation today is the result of infections several weeks ago, which became hospitalizations and then deaths this week. We will see deaths continue, I believe, to rise because they are a lagging indicator. But if we want to see if our recent closures are working. And I want to thank all of the LA residents and businesses that continue to do the right thing and to help others do the right thing as well. In their households, in their workplaces, keep your resolve strong. And I'm going to continue throwing everything we have in our fight against this virus. However, in the past 2 weeks, we received 549 complaints of businesses that were not following the protocols, that were not compliant with the orders of the state and county and city. So starting on Monday, I'm announcing we are relaunching the Business Ambassadors program that showed us so much success early on in this fight, sending out dozens of city workers who will every day visit businesses where we have a report of a problem and non-compliance. These business ambassadors will help remind businesses, educate them, encourage them before we go towards enforcement. And you can find all the rules if you're a business. Double check them this weekend at coronavirus.lacity.org/business. It is our goal to educate, to encourage, before we have to turn to law enforcement. But as you've seen, we have not been afraid to do that, to refer criminal cases to our city attorney's office, to file those cases, and to make sure that businesses that are violating public health orders are held accountable. I'd also like to take a moment to address news reports and also viral videos of street vendors being harassed, robbed, and in some cases even physically assaulted on our streets. Like so many of us, street vendors are suffering in this crisis, and they are some of the most vulnerable Angelenos, low income, elderly, and undocumented. We must keep working to make sure that street vendors have an active role in our city's economic present, in our recovery, and in our future. And I condemn this violence and harassment. I've instructed LAPD to look for any of these cases and to follow them to make sure that there is justice on our streets, and to work with the county to make sure we cut whatever red tape, as we've done with our LA Alfresco program, to help our street vendors safely be able to feed us during this crisis. There's also something we can do to help our city get the resources we need, and that is completing our 2020 census. Right now, our response rate that we have is only 51.8%. That means that 48.2% of us have not yet filled out our census form, and that's lagging behind California's 63% rate and the country's 62% rate. Don't send our money elsewhere. Don't get cheated out of what you deserve. Everyone needs to get counted. It doesn't matter whether you're an immigrant or native born. It doesn't matter your age, your housing status. You are a person who needs to be counted, and your personal information is safe and protected. So please go to my2020census.gov and fill out the form, or fill it out online, or fill out the form you received in the mail and mail it back. Or you can pick up a phone and call 844-330-2020. Earlier this week, Robert Redfield, the director of the CDC, said that we could bring this epidemic under control in 4 to 8 weeks if just everybody would wear a mask. And today in the New York Times, you saw the graphics of who is wearing masks. I was proud that while Los Angeles was better than most places, we still have more people who need to wear that mask. This is how you save the economy. This is how you reopen more businesses. This mask is not just about lives, which it is first and foremost. It's about jobs. This is about making sure your neighborhood businesses can continue to stay in business. Every Angelino must wear a mask. No mask, no service. And I cannot say this enough. The heat map showed that we are well above the national average of 56% compliance, but we need to get as close to 100% as we can. That should be our goal, all of us. To help communicate this message, my office has partnered with a great Los Angeles-based artist who is world-renowned, Shepard Fairey, who helped us recently have a more dynamic and artistic library card. But now, his studio, Number One, has produced this beautiful poster, encouraging everyone to wear a mask. You can download this poster yourself at coronavirus.lacity.org/maskart. And businesses and residents can post this in their windows because we all need to protect and respect. And LA is a creative capital. And the coming days, I'll share some more information about the LA Mask Print Project, which will harness the very best of our city's creative spirit and continue to get the word out. We know that data is one of the most critical tools in our fight against COVID-19. We can't properly manage our response without tracking key metrics, and each time I speak with you, we run through those numbers, so let me share them with you today. Cases, as I mentioned, continue to climb. Today's total was not as big as yesterday's, but we recorded 2,885 new infections, bringing our total to over 150,000 confirmed positive infections here in the county of Los Angeles. 978 of those cases were in the city of Los Angeles. And for comparison, those 2,885, when we were flattening the curve in May and June, late April and May, the county averaged about 875 new cases. Those seemed like big numbers then. We're well beyond that figure now. This week, in total, we logged 23,310 new infections, far surpassing last week's record of 17,128 cases. This week, as I mentioned, 3 days shattered previous records on Sunday, Tuesday, and yesterday on Thursday. And I'm sorry and sad to report that we had 62 deaths that the county informed us about today, passing the threshold of over 4,000 deaths, with 4,047 fallen Angelinos. We must not allow ourselves to become numb to those numbers. I know when we went from 10 to 20, we felt it, and from 20 to 100, how deeply that hurt. And now as we see these numbers climb, they just seem like that, just numbers. But they are people, and we'll be sharing one of those stories with you in just a moment. Hospitalizations continue to climb. They now stand basically at the highest level. It was the highest yesterday, slightly under today, but our second highest level ever right now at 2,188. And across the county, there are 624 available beds, including 435 acute care beds and 102 ICU beds. We're on the brink of going to double digits, dropping down to double digits of our ICU beds available for the first time since I've given these reports. We do have 1,094 available ventilators, a very strong and robust stockpile. A month ago, though, just to put our ICU patients in perspective, we had 404 Angelenos in intensive care. Today, there's 604 who are severely sick. That's a 50% increase in the last month alone. And for those of you who think that young people are immune, that's simply not true. 30% of people severely sick in the hospital are younger than 40 years old. And 8.4% of those infected in California are kids who are younger than 18 years old. Nearly 11,000 children younger than 18 have tested positive since this pandemic began. And while children are not as vulnerable, they can spread the virus to older and more vulnerable people in their household. The county now estimates that the rate of transmission has gone up since last week. It's at 1.07, which means the virus is still spreading, and about 1 in 230 people in LA County is currently infected and infectious. This increase from 1.01 last week to 1.07 may seem small, but it is not. It is significant, and it's not the right direction. If you think you have been exposed, ask your doctor for a test first, or get tested at CVS or a community health center, or one of our city, county, or state sites. At city sites this week, we offered more than 100,000 tests, a 25% increase, as I promised last Friday, from the previous week. And today we reopened our testing site in West Los Angeles with the Veterans Administration, which now means we have the capacity from the city sites alone to test 17,750 people each day at those 8 permanent sites. And that doesn't include the testing that we are doing at our skilled nursing facilities, where we've completed 2 full rounds in our mandate to make sure all folks in those facilities, both patients and workers, are tested. That doesn't count the work that we're doing in our homeless shelters, our pop-up test sites, and we understand that many people do not have a car to drive up to a testing center. So we are sending mobile testing teams around Los Angeles to them, where the need is immediate to make sure that everyone has access to a test. Through our mobile teams yesterday, we tested frontline workers on our docks who are helping deliver the goods that are in our stores today. These are 264 longshore and port workers who are members of the International Longshore and Warehouse Union. Our mobile teams also tested 173 people of the Jordan Downs housing development and will be at Nickerson Gardens development this coming week. And today, together with United Food and Commercial Workers Union, we conducted mobile testing at the Food for Less in Westlake Pico Union, where we saw an outbreak. And tomorrow we'll be there again, and we'll also be with our mobile testing teams at the Trinity Recreation Center in South Los Angeles. As a reminder, tests are prioritized. Even if they're available for everybody, they're prioritized for people with symptoms, who think they've been exposed, or who are essential workers or work in a high-risk environment. To find any of these nearly 100 testing sites, please, as always, visit coronavirus.lacity.org/testing or call 311 if you don't have internet access. The percentage of tests that are currently coming back positive is about 9.5%, which is well above where we were in late May at 8%, although it's significantly below what we're seeing in other cities, which are 25, 30, 38%. The 7-day average of new positive tests is 13.6% positive. The simple truth of this fight is that this virus is infecting more and more of us each day. At this point, too many of us know somebody who has been infected, badly hurt by this disease, or who has perished. So many families are grieving the loss of a loved one tonight, and my heart goes out to each and every one of you. I've experienced that loss in my family. I know that that is with my coworkers, hit them hard. This is something, the longer it goes on, that writes more and more pages of tragedy for each one of us. But I'm so proud of our city workers. I promised we would never stop working, and how you've stepped up, whether it's curbside delivery of books right now, or whether it's those of you who are at testing centers, homeless shelters, doing that work as business ambassadors. Thank you for showing up and showing the people of LA what our spirit is all about. The quiet acts of courage and compassion that city workers take every single day make this city safer and stronger and more secure. One of those city workers was Santos Barahona. Santos Barahona embodied the best of this spirit working at our airport, which all of us own. In Terminal 2 at LAX, he was a custodian, dedicated to his work, proud of his job, talking to his family. He loved to work and worked hard every single day. Nothing could keep him away from a job that he loved. Serving the people of Los Angeles, a gateway where families are reunified, where jobs are made, where visitors come to visit our city. He was the face of Los Angeles, making sure that we shined every moment. An immigrant from El Salvador who moved here decades ago, like so many of us who are immigrants or children or grandchildren of immigrants. He helped bring Los Angeles to the world and the world to Los Angeles. Santos passed away this past Saturday due to complications from COVID-19. We all know and see on the news each evening those beautiful, iconic towers at LAX that are lit up in different colors. Last night, we turned them off in Santos's honor, kept them black to remind us of the devastating toll and to remember and to show the love that we have for Santos and his family. To his wife, Araceli Valle, to his daughter, Claudia, who works with us here as well, to his co-workers at LAX, and to his entire city family, I know nothing can ease the pain that you are feeling right now. Know that we are thinking of you, that we are grieving alongside you. Know that we feel this loss and that we are sending you our love. In the face of this crushing crisis, let us be the generation that answered the call. Let's be the generation that took the simplest steps to save lives and to save our economy. Where everyone wore a face covering, where everyone stopped gathering. The generation that made sacrifices so that we would be with loved ones even sooner. So businesses could reopen faster, so that our children could be back learning in schools sooner, so that we could return to the cherished spaces and the places that make life so meaningful, not just here in Los Angeles, but in our lives, throughout our lives. If we do our part, we can and we will. I assure you of that we are strong and we can maintain being in control if we take these simple acts and we write our generation's chapter as boldly and as bravely as anyone who came before us. So as always, I'm sending you strength and love and justice, Los Angeles. Thank you. I'm going to speak in Spanish next out of respect to the Santos family, and then I'll be, as always, answering questions. Hoy marca un poco más de 4 meses desde que Los Ángeles fue la primera ciudad en la nación en cerrar sus negocios. Hoy tengo buenas noticias para ayudar a los pequeños negocios. En colaboración con el concejal Price y la presidenta del Consejo Municipal, Nuri Martínez, nuestros colegas en el Consejo Municipal, estamos invirtiendo $10 millones adicionales en el Programa para Recuperación Regional de COVID-19 de Los Ángeles. Esta es asistencia por nuestros negocios. Esto es además de $3 millones dedicados a este esfuerzo. Ahora podremos ofrecer más becas para microempresarios, pequeñas empresas y organizaciones sin fines de lucro en el condado de Los Ángeles, para ayudarles a mantener sus empleos sin tener que contraer más deuda con préstamos. Estos fondos son específicamente diseñados para asistir a nuestras empresas más vulnerables, muchas de las cuales no reciben apoyo del Programa Federal para la Protección de Ingresos. Para aprender más de este programa y someter una solicitud, visite la página lacovidfund.org o comuníquese con uno de los centros municipales de recursos para negocios. Llámanos a 311. La próxima ronda de aplicaciones se abrirá el lunes y quedará abierta durante la semana. También estamos ayudando a inquilinos y dueños que están sufriendo. Nuestro programa para asistencia de renta está dedicando $103 millones para ayudar a inquilinos a poder quedarse en sus casas, al ofrecerles $2,000 para ayudar a cubrir la renta a nuestros hogares con mayor dificultad económica. Hasta ahora se han sometido más de 200,000 aplicaciones esta semana. El plazo para aplicar se acaba esta noche. Si necesitas asistencia, aplica ahora. El plazo para aplicar se mantiene abierto hasta las 10 de la noche por teléfono y medianoche en la línea. Para someter su solicitud, visite la página hcidla.lacity.org o llame al 844-944-1868 hasta de las 10 de la noche. Nuestra meta es proteger a todos los angelinos de infección. Y ahora esto es un gran problema. Como lo dije esta semana, nuestro nivel de riesgo COVID-19 estaba en anaranjado y se acercaba al rojo. Si llegamos al rojo, tendremos que regresar a la orden completa, más protegidos en casa. Hoy no estamos anunciando cierres adicionales. Empezando el lunes, estamos lanzando de nuevo nuestro programa de embajadores de negocios, desplegando docenas de funcionarios municipales para visitar a negocios donde hay una queja de un problema. Estos embajadores nos ayudan a recordarle a los negocios las reglas, y estas reglas se pueden encontrar fácilmente en la página coronavirus.lacity.org/business. También quisiera tomar un momento para abordar los reportes en las noticias y los videos virales que muestran robos, acoso y ataques violentos contra vendedores ambulantes. Tenemos que asegurar que los vendedores ambulantes tengan un papel activo en los esfuerzos para la recuperación económica de nuestra ciudad. Y condeno esta violencia y acoso. Esto tiene que parar. Le pido a los angelinos que reportan estos incidentes a la policía. Y estamos trabajando con el condado por más acceso y más recursos para nuestros vendedores ambulantes, especialmente con el Departamento de Salud. Además, algo importante que puedan hacer para ayudar a que nuestra ciudad reciba los recursos que se merece y que necesitamos es completar el censo 2020. Ahora nuestra tasa de respuesta es muy baja, solo 51.8%, detrás a la tasa de respuesta del estado de 63.3% y la del país 62.1%. Necesitamos que todos se hagan contar, especialmente en nuestra comunidad hispana, nuestros inmigrantes. Y recuerde que su información es confidencial. Responda en línea en la página my2020census.gov o llene al formulario que recibió en el correo o hágalo por teléfono llamando al 844-330-2020. Cada angelino debe llevar una mascarilla. Para comunicar este mensaje, mi oficina se alió con Studio No. 1, el estudio de Shepard Fairey, el artista, y han producido un cartel alentando al público a llevar una mascarilla. Puedes bajar este cartel en la página coronavirus.lacity.org/maskart. Y negocios y residentes pueden colgar este cartel en sus ventanas porque todos tenemos que proteger y respetar. Los Ángeles es una capital creativa y en los días que vienen les compartiré información sobre el proyecto de grabados de mascarilla para tomar ventaja de lo mejor del espíritu creativo de la ciudad. La información es muy importante en nuestra lucha contra COVID-19. Los datos de hoy. Los casos continúan incrementando. Hoy el condado nos informó de 2.885 nuevos casos. En total tenemos 150.319 casos. 978 están en la ciudad de Los Ángeles. También el condado reportó 62 fallecidos, y lo que nos lleva a un total ahora más de 4.047. Las hospitalizaciones siguen subiendo también y llegan a 2.088. Y en el condado hay 624 camas disponibles, incluyendo 435 de cuidados agudos y solo 102 camas de cuidados intensivos. Y hay 1.904 respiradores disponibles. El condado ahora estima que la tasa de la infección ha subido durante la última semana. Ahora está al 1.07, lo cual significa que el virus está en propagación y cada persona entre 230 está infectada. Si piensa que ha sido expuesto al virus, hágase una prueba, por favor. Hoy abrimos de nuevo el sitio de pruebas de la Administración de Veteranos del lado oeste de Los Ángeles, lo que significa que hay capacidad para hacer 17.750 pruebas todos los días en nuestros 8 sitios permanentes de pruebas. Recuerde que se da prioridad en las pruebas a las personas con síntomas, aquellos que crean que han sido expuestos, y a trabajadores esenciales o en trabajos de alto riesgo. Visita coronavirus.lacity.org/testing o llame al 311 si no tiene acceso al Internet. Este virus está infectando a más personas cada día. Y ahora muchos conocemos a alguien quien ha sido infectado o quien ha muerto de esta enfermedad. Esta es la situación en mi familia. Nosotros hemos perdido un primo de mi papá. Demasiadas de nuestras familias están llorando la pérdida de un ser querido. Y estamos sintiendo el mismo dolor hoy en nuestra familia municipal. Santos Barahona trabaja como un custodio en la Terminal 2 de LAX. Él estaba dedicado a su trabajo, orgulloso de su trabajo, y casi nunca tomaba un día libre. Como tantos angelinos, Santos era un inmigrante quien llegó a Los Ángeles hace décadas de su tierra materna, El Salvador. Con su trabajo, Santos ayudó a presentar a Los Ángeles al mundo y al mundo Los Ángeles. Él ayudó a mejorar nuestra ciudad. Santos falleció este sábado pasado de COVID-19 y en su honor anoche apagamos las luces de los pilones icónicos de LAX en respeto a su familia y a su vida. A la familia de Santos, a su esposa Araceli, su hija Claudia y sus colegas en LAX, y a su familia municipal entera. Nada puede aliviar el dolor que sentimos. Estamos pensando en ustedes, llorando con ustedes, sentimos la pérdida y les estamos mandando fuerza y amor. Mientras enfrentamos este virus devastador, seamos la generación que se presenta para tomar acción. Seamos la generación que tomó los pasos simples para salvar vidas. Por favor, sean parte de la solución. Entonces, quédense protegidos, quédense en buena salud y quédense en casa. Mucha fuerza y mucho amor y justicia, Los Ángeles. Gracias. Thank you, and as always, take questions. Thank you for your patience. Take first question.
First questions from the line of Claudia Persciuta, KNX News Radio. Please go ahead.
Hi, Claudia. Good evening.
Hi. I have a couple of questions. So we are seeing a growing number of cities threatening fines for not wearing face coverings in public. And given how important you say masks are to slowing the spread and the threat of another lockdown in Los Angeles, why isn't the city doing the same? My second question is, it's about testing, it's a couple. What's the current turnaround time on results? Any plans to further expand testing capacity? And has the city run into any supply shortages at this point? My third question is regarding the video of the altercation between Joshua Wilson, the man in the wheelchair, and LAPD officers at a protest in downtown this week. Do you have any concerns about the way police handled the situation? Thank you.
Sure, I'll go with reverse action. I've always learned early on to make sure we gather all the facts before speaking to a story. Oftentimes we can see video that's a partial clip. I spoke to the police chief today and made sure that we will be releasing all the body-worn video to make sure there's a full story there. I know the LAPD has spoken to that to some extent about whether the individual started punching at officers and had a loaded weapon, and to place that all in proper context. But of course, any incident like that requires proper investigation, transparency, and accountability. So I will reserve my judgments until I've been able to see all of that evidence. I've heard things on multiple sides on that, but we absolutely promise the public full transparency and accountability on that. With the second one, it's about a 30-hour turnaround time, more like 28 hours right now is the average, so we're in a good place on our turnaround time, which is in huge contrast. As you know, and we've talked about this here, we've had pinch points where it's gotten up to a week before, but those have been rare exceptions. By and large, we've had 1 or 2 days, and right now, even with the additional capacity, we're looking at an average of about 28 to 30 hours. So that's been very strong at a moment when across our nation, we're seeing 7 to 14 days be the average, and labs just completely overwhelmed. Again, we found a local lab. We work exclusively with that lab for our drive-through and walk-up centers. In terms of our shortages, no, our supplier feels strong, though I do think it is something that is going to be a nationwide problem. From reagents to swabs, this is something we have talked about for months, and the idea that out of Washington we haven't mobilized our overall national industry to make sure that we don't have these choke points, to me, is one of the great tragedies of these 3 months. We're doing our part. Local governments are stepping up. I was speaking with the mayor of Phoenix, where they were having 8-hour waits, and she's had to try to build what we've built over many months here. It shouldn't be our responsibility, even though I'm proud of what we have done. So absolutely, we are in much, much better shape. But I do think somewhere on the horizon, especially if cases don't come down, we are facing shortfalls, but we have nothing imminent for our testing regime. And last, with masks, we continue to pass out masks, to let people know those lessons. Even the places that quote unquote have that, I don't believe there's been fines given out, they're warnings, and we will continue to do that same stuff. But I think it is an explosive issue for us to be able to say where those fines would be, who would have them, where that hits somebody with low income. I'm proud that our numbers are way beyond the national average, as showed by that New York Times. We're going to continue pushing 100%, but it's educate, encourage before we enforce. Thank you, Claudia. Take the next question, or set of questions. Take the next question.
Next question is from the line of Robert Kovacic with MDC.
Hey, Robert.
Hi, Mayor. Happy Friday to you.
You too.
Hope you're well.
Thank you.
Just break this down for us. You said today we're holding off on any additional closures to see what the impact may be.
Yep.
So what exactly does that impact mean? What exactly are we looking to see in terms of tracking cases, hospitalizations, and deaths? I mean, frankly, I'm sure you are as well, but we are asked every single day when we have these record-breaking cases and numbers coming through, what's it going to take to shut LA down again for many people that are really concerned about this? And I know it's the last thing we want to do, but what are we waiting for now to see if that possibly could happen?
So a couple things. Closing things down requires more discipline than quite frankly was shown, and opening things up requires more discipline, quite frankly, than what was shown, and closing things down also requires discipline. What do I mean by that? As I've said many times on this, if we are going to open things up, We should open something up, wait 2 to 3 weeks and see its impact, and then assess whether we can take another step forward. That's initially how this started. And then we saw a domino effect. And I want to be clear, it didn't come out of the city, but there was a domino effect of openings that just surged. I think nationwide there was that feeling, many states took that feeling, and again, they opened things up before we were able to get the feedback of 2 or 3 weeks to see, okay, maybe that thing was causing too much of outbreak. Similarly, when we're looking at closing things down, and I support the governor's actions to close things down this past week, you also need 2 to 3 weeks to see the effect. Because if you just go with this moment, you're basically making decisions based on where we were 2 to 3 weeks ago instead of right now. That's why I prepared people for this. I said last week, as we take these steps, it will take about 2 weeks for us to see the effect of them. And I'm hopeful and optimistic that they will have an impact. But if after those 2 to 3 week periods, so another week or so, maybe 10 days, we still see things getting worse, and most importantly, it's not just the case load, it is the hospital capacity. And what our hospitals who are smarter now, that's why I mentioned a lot of the stuff about the therapeutic and treatment insights, the shorter stays, and the younger population, those together, which are the good news pieces, with more people getting infected, the bad news is, sometimes can counterbalance each other. So I am looking very closely at the data. I'll be looking at that in this coming week. Today would be more just going off of emotion and not on necessarily what we see the impact of 2 weeks. So I will look at those, and I hope that we've learned that lesson about the reopenings, that we should take one step at a time and wait a few weeks, see that impact. That's why I want us to have a common goal, which is to try to get off that watch list of the state for 14 straight days. That will require us to do those 4 basic things that I always mention of masks, distance, staying home, washing our hands and surfaces. But also, one last thing I would say is for those who say, shut it all down, we're much smarter than that now. It was never all shut down. We had things like our construction trades where we were able to go in there, shut down work sites that are bad, but keep other ones open and not have huge outbreaks. We're able to do that with farmers markets, et cetera. So we can figure out ways to not take just a cleaver straight across our city and cause the widespread suffering that many businesses and workers will never recover from. We can be more surgical, but it is time for us to take those surgical moves, wait a minute, see what the impact is, and I will not be unafraid to go further if we see those actions not having an impact. The last thing I'll say, and I know this gets complicated, it's not just about what's open and what's closed. Much of this is also about our actions. You could close plenty more, but if young people were still congregating outside of their household in large numbers, we would still see spread. If we have essential workers without their employers providing PPE and mandating that they wear them and giving them enough space between them at some of these places like factories that are making masks, then you will see spread. So it's not just about what's open, it's about enforcing those rules ourselves, and making sure that the practices recommended to us that we ourselves are doing that work, or else we won't see schools open and we may see further steps back. Thanks, Robert. Okay, I'm told that's the last question. No questions in Spanish tonight. Thank you all so much. Have a good weekend. We'll see you next week.